Hi guys. Okay, today's study tip: take a day off from work if you're stressed, especially if you're stressed out about having enough time to study. Okay. Another way to handle this would be to reduce your schedule, right? So request fewer hours. You might find that as few as 5 hours a week is enough to help with this work school balance. Another suggestion is to plan in advance. You know your exam dates. Plan a day somewhere near that um, to have an additional time off before the exam, right? But don't wait until the day before the exam to do all your studying. It's not what I'm saying. Okay. So part 1 of chapter 13 focuses blood. Then we'll do part 2, which is the focuses on circulation. Okay, so recall, you probably already know, blood plasma is the liquid portion of your blood. And we say it's the liquid portion, so this does not include your red blood cells, right? So the hematocrit is the portion of your red blood cells. Plasma is everything else. Okay, so it's 90% water. This is going to contain all of your nutrients, so food. Of course, it's food that's been broken way down into all the individual components, right? And then is absorbed from your intestines. Okay, salt, oxygen from your lungs, wastes that are being produced from all of your tissues from cellular respiration, okay, and proteins. And these proteins are more than likely the proteins that are being produced by your cells that take their function outside of the cell as messengers, or they're being delivered to a different cell, which will then be taken up by that cell and have a function. Okay, so these are separate from your food nutrient proteins. Anyways, other proteins that you find in your blood are specifically there for the function of your blood. These include albumin. These are carriers, as we've talked about before. Remember, they're really big. They didn't fit through any of the membranes that we looked at for diffusion. And these are primarily carriers for lipids, and we talked about that also when we talked about steroid hormones, and albumin is a carrier for your steroid hormones as well. You'll also find your globulins in this protein portion of the plasma. Globulins include immunoglobulins, right? So all of your antibodies for protection against infectious disease, which is a huge topic right now, right? If we had the ability to make a vaccine quickly enough for coronavirus, we would administer the vaccine. This would promote your body to produce immunoglobulins that would then protect you from the coronavirus. Then we wouldn't have to be doing all this work from home business, right? So anyways, we don't have the vaccine yet, so we do have to work from home. But that's how immunoglobulins work and vaccines. Okay, but you make a lot of immunoglobulins yourself from actually getting sick and having to do it the hard way. Vaccines allow you to do it without having to be sick first. Okay, and then lastly, proteins, fibrinogen, which we'll be talking about when we talk about the process of making blood clots. So we'll see that towards the end of this lecture. Okay, serum. You may have heard people talk about blood serum, and that is the plasma without your clotting factors, okay? And so that's actually this fibrinogen right here. Oh no, my mouse will work. Here we go. Fibrinogen is your clotting factor. So if we were to take a sample of blood, spin it down, get just the plasma, then we would clot that. In other words, remove the fibrinogen, and then you would be left with just everything else. And this is usually how we do tests to see, do you have antibodies for a particular pathogen? Do you have the correct levels of nutrients in your blood, things like that. Okay. So more about constituents of blood. So what we were talking about just now was this yellowy portion here, the blood plasma. If you were to have a good blood sample and you centrifuge it down enough, you would then get what we call the buffy coat, which actually has all of your white blood cells and your platelets. But sometimes you'll have a blood plasma that still contains the white blood cells and the platelets. So in other words, you don't always have this buffy coat. Okay, so now in this green square here, this is if you were to just take a person's blood without centrifuging it, you just take blood, whole blood as is, and you smear it and you look at it under a microscope, you're going to see mostly red blood cells. In fact, you'd be lucky to see even just one white blood cell. They show a lot in this picture. I don't know why. You could scan a blood smear for a while before you see any white blood cells. Okay, if you actually saw this, this would be a really unusually high amount of white blood cells and we'd be concerned. Okay, this is also another white blood cell. And then you have these little, what might look like broken up cell parts if you were looking at it. And they wouldn't necessarily be all clumped together, they'd be scattered about. And those are your platelets, right, that we use for blood clotting. And so, again, this is a blood smear before you've centrifuged your blood down. Okay, now back over to the left, this is centrifuged blood sample. Okay, at the very bottom is the hematocrit. This is just the red blood cells. Okay, so this diagram is a little confusing because it says formed elements. So I want you to take note that the formed elements are taking both the hematocrit and the buffy coat and calling those the formed elements, which include your white blood cells, your platelets, and your red blood cells. However, just the red portion is the hematocrit, okay? All right, so if you are interested and you think you can handle taking blood samples, you might want to consider getting your license or certificate to be a phlebotomist. A lot of people become a phlebotomist while they go through nursing school so they can make some good money, get some really excellent healthcare experience under their belt. And then other people do it and they find that they really enjoy it. I actually have a friend who was starting nursing school. She did this whole phlebotomist certificate, really liked it, and has worked her way up and did not continue nursing school but decided to make phlebotomy her career, and she's been doing really well with that. Okay, so that's also something you can consider, especially if you don't really enjoy taking all of these classes, right? And maybe you don't even really want to do nursing school. Okay, so anyways, I mentioned taking a blood sample and centrifuging it down. So recall a centrifuge is a machine, and if you're having really small tubes for samples, you would use a small or even micro centrifuge, and then the bigger your sample, the bigger your machine will be. But anyways, what it does is it spins very quickly so that the heavier particles in your sample go the farthest to the bottom, and then everything, depending on how heavy it is, will fall more or less towards the bottom, right? So the lightest portion of your blood is the plasma, the heaviest would be the red blood cells. Okay, so in lab, we would not have had a big sample like this. We would have had a small capillary tube, which is just a tiny glass tube that you would have put up to a drop of blood from your finger, and you would have seen the drop of blood go through the tube on its own through capillary action, and then we would have spun that down, and you would have seen only a division of plasma and red blood cells because the buffy coat would still be mixed in with the plasma. You wouldn't see a buffy coat, you would just see plasma. And you'll see that when you watch the lab intro for Monday's lab. Okay, next. So the formed elements, as I mentioned, include the buffy coat and the red blood cells. Okay, so first, the red blood cells, the proper name for that is erythrocytes. They have a disc shape. They do not have mitochondria. They do not have a nucleus. Okay, and they can live for about 4 months before they break down. And so we're constantly making and replacing these, but that's a really long lifespan, 4 months. And as you know, red blood cells contain hemoglobin, and the hemoglobin contains iron, and this is how we get our oxygen. So we're going to talk about that for a little bit. So recall, if you had something with iron in it and you left it outside, it can get rusty, and the color of rust is red, right? Okay, so when your blood becomes oxidized or goes to the lungs and picks up oxygen, it's going to turn bright red. Okay, blood where it's already circulated through the body and it doesn't have very much oxygen is going to be a darker color, or dark red brown. Okay, and it'll be a brighter red once it picks up oxygen. Okay, so a little bit more fun facts. The adult human, and sorry for the weird noise, that's me sipping on my tea. The adult human has roughly 20 to 30 trillion red blood cells at any given time. Women have less than men, 4 to 5 million for women and 5 to 6 million for men. And notice my numbers got much smaller. I went from saying trillion to million, and this is because if you just look at a microliter of blood, or another way to think of it as a cubic millimeter. Okay, so if you take a milliliter of blood and you look at women, they're going to have 4 to 5 million red blood cells, and men are going to have 5 to 6 million. Okay, and then people who live at high altitudes are going to have even more. Okay, there's less oxygen the higher the altitude, and so to compensate, to make sure that you're still getting enough oxygen to all your tissues, your body will make more red blood cells, and that takes about 2 to 3 weeks. Another really cool thing to note is that a human red blood cell can typically travels through your entire body in just 60 seconds. So that's super cool too. Okay, so back to hemoglobin. Each human red blood cell, so each erythrocyte, contains approximately 270 million hemoglobin molecules. So each little red blood cell, erythrocyte, carries a lot of oxygen, okay, a lot. Because each individual hemoglobin has these 4 units, and each of those 4 units has a heme group, shown here in red. Okay, each heme group can carry 1 oxygen. Hemoglobin, as you can imagine, having 270 million hemoglobin per cell, then hemoglobin's going to be about 1/3 of the total volume of a red blood cell, right? So your red blood cell is predominantly made up of hemoglobin. And that makes sense because the whole function of a red blood cell is to bring oxygen to your tissues. So at the center of each heme group, right? So the whole structure here again is hemoglobin. In the middle of each subunit of hemoglobin is the heme group. And in the middle of the heme group is iron, and that's where the oxygen actually binds. Okay, so again, 1 hemoglobin can hold 4 oxygen because there's 4 heme groups, which means there's 4 irons. Anemia is, there can be a lot of causes, but anemia means there's not enough oxygen carrying capacity in the blood. This can be due, and is typically due, especially in the United States, it's usually due to not having enough iron in the diet, or having a disorder where your hemoglobin is not able to correctly get all the iron. You can also have sickle cell disease. This is when your red blood cells are misshaped. They become a sickle shape, and then they are not functional. They can't function when they're sickle. So when someone has sickle cell disease, not all of their blood is sickle, a portion. And so the higher concentration of sickle cells, the more diseased that they would be. Like I mentioned, you can have hemoglobin issues. And then another common cause of anemia is actually not producing enough red blood cells in the first place. And that is usually due to a vitamin B12 deficiency. And we call this pernicious anemia, right? So, of course, if you have anemia due to a lack of iron, you would eat foods that are rich in iron, like spinach, broccoli, right? Dark leafy greens. You might also be put on an iron supplement. You might be told to eat more red meat. What else? If your anemia was due to not making enough red blood cells, one of the things they would do is make sure you're getting enough vitamin B12, which again, in addition to natural sources, probably would mean taking supplement as well. There are still other possible causes of anemia, but these are the most common, right? So low iron, sickle cell disease, or sickle cell anemia, as it's usually called. Vitamin B12 deficiency, called pernicious anemia, means you're not able to make enough red blood cells, or other hemoglobin issues. Okay. I'm really elaborating on anemia. It's also it used to be covered in lab, and I'm not sure how much it's covered anymore now that we're moving to Physio X. I need to double check. So I want to make sure that you get that. So anemia is talked about in your textbook, so you can also look at it there. Okay, so still looking at the formed elements, this bottom portion of a centrifuge tube, everything except for the plasma, right? So in that buffy coat, you would also have white blood cells, and the white blood cells are called leukocytes, okay? Leukocytes can be broken into 2 groups, granular and agranular. Granular leukocytes include your neutrophils, eosinophils, and basophils. Your neutrophils are your first responder to infectious disease. They are the most numerous type of white blood cell in your system, okay? Eosinophils and basophils have some overlap in their function. They're both going to be seen in high numbers if you're fighting a parasitic infection, although eosinophils are the primary, they're the first responder for a parasitic infection, and then their response will end up recruiting some basophils to help them. But it's so when we think of the primary role, eosinophils fight parasites, but they are also implicated in allergies, and so are basophils. And that makes sense because basophils, their primary job is to make histamine and promote the inflammatory response of the immune system. They also make heparin. And so the heparin is actually an anticoagulant, which prevents your blood from clotting too quickly. And so it promotes blood flow, and your histamine is going to recruit more blood to an area So really, basophils help to keep and promote blood flow to help fight infection. Okay, and but again, too much histamine is going to cause a lot of inflammation, and that's what allergies are, when we have an inflammatory response to something that's not a pathogen, like dust and pollen. Okay, so eosinophils and basophils, very important, but when they misbehave, when they think something is a pathogen that's not, then it's allergies. Okay. Agranulocytes are your monocytes and your lymphocytes. When you hear lymphocytes, you should think T cells and B cells. These are the primary cells that are in your lymphatic system. They're hanging out in your lymph nodes, checking your lymph for any pathogens. Okay, super important. Part of your adaptive immune system. This is how you make antibodies to have permanent protection against disease. Monocytes are phagocytic cells. Well, monocytes are immature. They become macrophages, which are phagocytic. Okay, what else did I want to tell you? I'll talk a lot more on this next page. Thrombocytes are the platelets. Okay, so thrombocytes and leukocytes are the buffy white coat layer. And together with your erythrocytes make up your formed elements. Okay, so again, as I just said, all of the white blood cells, all the platelets, and all the erythrocytes together are called your formed elements. If you're able to achieve a buffy white coat layer, that would be just the white blood cells and platelets. All right, so let's talk about these appearances in a bit. So white blood cells, as you know, are called leukocytes, and these are very different from erythrocytes because, well, erythrocytes don't have mitochondria and they don't have a nucleus, but all your white blood cells have really pronounced nuclei, right? All these really huge dark structures are your nuclei of your white blood cells. Okay. Now, whether we call them granulocytes or agranulocytes depends on how they stain. And when we stain white blood cells, we do a stain with both a red dye and a blue dye. Okay, the blue dye is basic and the red dye is acidic. And so basophils, they stain very well with the blue dye, so that's actually where they get their name, base lovers, right? They love that basic dye, and you can see all packed full in that cytoplasm are the granules that stain from that dye. Okay, eosinophils, you notice they have a ton of granules in their cytoplasm as well, but they were acid lovers, the red acid dye, and so that's their name, eosinophils. For eosin is the red dye that they're attracted to. And then neutrophils, they didn't really like either red or blue dye, so you get very poor staining of their granulocytes in their cytoplasm. Okay. Neutrophils also have these very weird lobe nuclei, so very distinct, where you have a fat portion of the nucleus and then a very thin, and then fat and very thin, fat, very thin, right? So this is characteristic of a neutrophil. Okay, eosinophils have two lobes that kind of look like, well, I'll leave that up to you what you think it looks like, but you can see a very large lobe, very narrow portion, and then another very large lobe, and it usually is shaped like this, kind of like a funny looking C, right? Or headphones, rather. Maybe headphones that go over the ears is a better way to describe that shape. Okay, and then your basophils, look kind of more like kidneys, right? Your right and left, or your right and left lobe of your lungs, rather. Um, and yeah, sometimes this can look the way the nucleus is for eosinophils, basophils can look very similar, depending on where you've trapped, because these are three-dimensional cells. So depending on how you're seeing it, right, it can look different. So then again, you would look for the red versus the blue stain to really know which one's which. Okay, so another difference between white blood cells and erythrocytes. White blood cells, they are able to move like amoebas, like in an amoeboid fashion. They can squeeze through capillary walls to get into tissues towards the site of infection. That process is called diapedesis. We'll see that again in our immunity chapter. And again, your neutrophils, your eosinophils, and your basophils are the group of white blood cells called the granulocytes. The next group of white blood cells are your lymphocytes and your monocytes, and together those are called agranulocytes. Because notice you don't see all the crazy granules in the cytoplasm. I mean, they do have a few, but it's nothing like the others, right? Okay, they also have huge nuclei, right? Very huge. And monocytes are just the biggest of all the white blood cells. And again, monocytes will mature into macrophages, which are highly phagocytic cells and play a very important role as a middleman, innate and adaptive immunity. So we'll see this again when we get to our chapter on the immune system. Lymphocytes are going to be T cells and B cells. Again, they're in the lymphatic system, checking your lymph all the time for any invaders so that you can respond adaptive immunity, make antibodies against or specifically target and kill, depending if we're talking T cells or B cells. Again, we will get into all those details when we get into our chapter on the immune system. What else did I want to tell you? I think that is good. All right, so next slide. Okay, so the formation of blood cells. Poiesis, right, is to make. Heme or hema is referring to blood, right? So hematopoiesis or hemopoiesis is to make blood cells, okay? So we make our blood cells from pluripotent stem cells. You learned that in anatomy. Okay, adults don't have a lot of red blood bone marrow. You can find it in the sternum, the ribs, and the hips, right? Babies are born with pretty much all red bone marrow, and as you get older, as you grow, a lot of that is replaced with yellow marrow. Okay. Erythropoiesis, well, erythro, red blood cells, poiesis, making, good. Okay, so the kidneys monitor our concentration of red blood cells, and if it's getting low, the kidney will release a hormone called erythropoietin. Erythropoietin, of course, is going to stimulate erythropoiesis to make more red blood cells. If you have too much red blood cells, it's called polycythemia. Polycythemia is also talked about in lab, and this can be very dangerous. Having too many red blood cells is going to make your blood thicker, more viscous. That means it's more difficult to pump. That's putting more strain on your heart and on all the vessel walls by having higher red blood pressure. By having a higher blood pressure from having too many red blood cells. So again, this is very dangerous. And interestingly, we've found this in athletes. Athletes think, especially maybe high intensity runners, think that they can perform better if they have more oxygen, and they can get more oxygen if they have more red blood cells. And so they, some, not all, but some athletes, it became common to try to take a drug which turns into erythropoietin and stimulates more red blood cells to perform better. But again, like I said, it can be very, very dangerous. It may or may not even help them. But of course, even if it did help them win their sport, of course, it's not worth putting their life in danger, right? So a workaround, a lot of athletes will do what we call elevation or altitude training. And that is going to a higher elevation, usually something about a mile above sea level will work. And takes about 2 to 3 weeks. So you have to live there right at this higher elevation for a few weeks to get that higher level. Of course, they would still be practicing and exercising and doing all of their training as usual, but just being in the mountains for 2 to 3 weeks, you will have a higher red blood cell count. Oh. And again, that's because you have less oxygen at a higher elevation, so it's a natural response of the body to make sure that you're getting enough oxygen. But of course, if you come down the mountain and, within a day, a few days, you're going to still have that higher level of red blood cells. You do your race, and perhaps you get that 1 to 2 second advantage in your race, and you win the race. Again, not encouraging this because too many red blood cells can be an extra strain and be dangerous. Okay. Leukopoiesis, right? Poiesis, to make leukocytes, right? So making white blood cells. Cytokines are a type of chemical messenger, and there are a lot of different cytokines or cytokines, really is how I say it. I don't know why I'm saying it weird. Cytokines, you'll see this come up often, just means chemical messenger. We're not going into any specific names here because you have a lot of different types of white blood cells, and you're going to have different cytokines to initiate making more or less of these particular types. So we're keeping it general, okay? Very vague. Another term, right? If you make too many white blood cells, leukemia, right? So typically it's they're immature white blood cells, so they don't have their function. So even though you have a ton of white blood cells, they're immature, they're not helping you, you don't have immunity. Okay, so these people typically are very fatigued and they're getting sick easily. They might even be bruising easily. A lot of different symptoms. Of course, there are different types of leukemia, and we're not going to go into any of the specifics. Okay, so blood typing is my favorite part. Okay, blood typing, what we would have seen in lab is this little lancet. It has a tiny spring and a tiny needle, and so when you press down, it will push the tiny needle out very quickly, right, in out very, very quickly to poke a tiny hole. And notice you want to do it on the side of the finger. In fact, we recommend like the middle finger, on the side of the middle finger, just because it's less likely that you're rubbing it and it won't, bother you as much. If you do it on your fingertip, you're going to be touching that all day, and it's going to be sore and possibly, infected. So that's why we do it there. Anyways, so there's a well, what we call a blood typing well, and the first one says A, then B, and then RHO. Okay, and what you would do is you would place a drop of blood, a very big drop of blood, into each of these wells, and then you would come up to the front and I would give you the antibodies. We call them anti-A antibody, anti-B antibody, and anti-RH. And then we would see which ones coagulate, which ones clump up. And in this picture, we have no clumping in A. I don't know why the RH is completely clear in this image. It was the best image I found online of a well where you could see everything labeled. So perhaps they're in the process, they haven't added their blood or their antibody. Normally, like you see in A, you just have blood. When you add the antibodies, if they don't coagulate, then it just looks like blood, okay? When it does coagulate, then you see all the dark spots, okay? And then, like I said, in this image, they just haven't done this well yet. Okay, so you know that you can be blood type A, B, AB, and if you're type O, we say either O positive or O negative, right? Well, we actually would say that for A as well. Are you A positive or A negative? B positive, B negative, AB positive, AB negative, or O positive, O negative. And so what does that mean? Well, antigens, surface proteins on these blood cells, and there are, these three types of antigens. You can have an A antigen, a B antigen, or an O. Well, not an O. An O is the lack of A or B, but something called the RH. The RH antigen we refer to as being your positive or negative. So I know it's a little weird. So if you have the A antigen, we say that you're type A. But if you are type O, it means you don't have A and you don't have B. And then lastly, if you're positive or negative, it means you're positive or negative for RH, the third type of protein. Okay, so antibodies, as you know, will bind to surface proteins called antigens, right? So antibodies are proteins or immunoglobulins in the blood that recognize, very specifically, they recognize foreign antigens. So really what we mean is you have antibodies in your body. They are not going to bind to any of your own antigens. They're only going to bind to pathogen antigens. Okay, but they do that very specifically. And so that's why we say seek and destroy, by binding to the specific antigen. Okay, so if they bind foreign red blood cells, you'll get a clumping called agglutination. Okay, so we'll talk about this some more. In this well, we have clumping. What does that mean? The person's blood contained the antigen B. We added the antibody, anti-B antibody. And because the person had B antigen on their blood, we saw clumping. Okay? In this first well, the same person's blood did not have antigen A. So when we added the antibody, anti-A, nothing happened because they didn't have the antigen. Okay, so they are not blood type A, and they are blood type B. We do not know if they're positive or negative until the RH test is performed. Okay, so what does this mean? If a person is type A blood, they must be given type A blood only, right? If you give them type B, they will attack it. If you give them AB, they'll attack it, right? So on and so forth. So technically, if a person is type A, you could give them type O blood because type O doesn't have any of those surface antigens. Of course, you need to check your RH, right? Are we saying this is A positive or A negative? And you need to match that. Okay. O negative doesn't have any antigens. O negative doesn't have A, doesn't have B, does not have RH. So O negative is what we refer to as the universal donor. Technically, anybody could receive O negative blood and not have a problem. Okay. So if a person, type A person, is given B, that's going to be a big problem. They're already going to have, or they're going to very rapidly make antibodies against type B and attack it. Then you're going to have all sorts of clotting and inflammation, and this can kill a person, giving them the wrong blood type. Okay. Again, same thing with AB, because those B antigens are going to be attacked. So which blood type can O accept? Only O. And again, you need to make sure if that's positive or negative. O positive can take O positive or O negative. O negative can only take O negative. Okay. So RH factor, I keep talking about this. This is another antigen. It was first discovered in the rhesus monkey, so that's why we call it RH. Okay, so it's another antigen found on red blood cells. So you have A antigen, possibly, B antigen, possibly, and RH antigen, possibly. So we need to test for all three of those antigens when we determine blood type. If you have the RH factor or you have the RH antigen, we say that you're positive. Okay, so a person who's A positive would have both A antigen and RH antigen. If you don't have RH factor, you're negative. So A negative would mean they have the A antigen and they do not have the RH. All right, so in addition to blood transfusions, another really important implication, or application rather, is for a pregnant mother. If a mother is RH negative, so A negative, AB negative, or O negative, right, any of the negatives, she's at a very high risk of having a problem. So if her child is RH positive during labor, she becomes exposed to that blood, right? The placenta breaks, everything. Yeah, she has been exposed during labor, during childbirth, to this RH antigen on her baby's blood. And her body will respond by making antibodies. So this first baby is fine, healthy, normal, everything went correctly. Mom's fine as well. But if she gets pregnant again, the baby may or may not be RH positive. So in this example, the second baby is RH negative. So again, no problem. Even though mom did make antibodies from the first baby, the second baby doesn't have the antigen, so there's nothing there for the mom's antibodies to attack. But as you can see in the for this third child, it's not going to survive. The third baby is RH positive, just like the first baby, but mom already made antibodies when she had the first baby. So now those antibodies are going to cross. They always can cross the placenta. They always do. It's just in the second baby, the baby didn't have the antigen, so even though the antibodies crossed the placenta, nothing happened. In this third baby, the baby has the Rh antigen, and now those antibodies are going to attack it, and that's going to, we call erythrocytes fatalis, which is attacking of the red blood cells, and that kills the fetus. So very sad. So what we do when a mother is expecting and we find out that she's negative blood type, we give her RhoGAM, and we give it again during and after childbirth to prevent making these antibodies, so that for each subsequent pregnancy, you administer the RhoGAM. Again, this drug blocks the production of the Rh antibodies, and then that way the mother never has to experience this tragedy of losing the fetus. Okay. I'm going to stop here and then make another video to finish out the rest of this very long lecture. All right, so this is part 2. Make sure you watch part 3.